And we are going to go ahead and get started, everyone. Thank you so much for joining us this morning. Welcome back to everyone who's joined us in past webinar sessions and everyone joining us for the first time. My name is Helen Roldan, and I'm a Research and Outreach Coordinator for the FIU Jorge M. Perez Metropolitan Center. This morning, I'm going to be one of your co-moderators. Before we begin, I'm going to briefly introduce today's webinar, The Impact of COVID-19 on Hurricane Preparations. We have some great experts here today, experts in the field ready to discuss. Today's session is going to be a mixture of panel style and presentation style. So our panelists will be answering questions from the audience, both during and towards the end of the session. Throughout the duration of the presentation, you will be automatically muted, but we ask you to please ask questions. You can type them in on the chat feature in your Zoom window. We will try to get to as many as possible. You can also directly send them to me, Helen, privately, and I'll make sure that your question gets answered towards the end. We are going to be recording this session, and we'll be posting the recording on our website. We're also going to be emailing all participants a copy of today's presentation. Now I'm going to turn the mic over to our center's director, Howard Frank, director of the FIU Jorge M. Perez Metropolitan Center.
Thank you, Helen. Good morning, everyone. I'm Dr. Howard Frank, director of the Jorge M. Perez Metropolitan Center, a vital part of the Stephen J. Green School of International and Public Affairs at FIU. Thanks for joining today's webinar, The Impact of COVID-19 on Hurricane Preparation. Our program is a joint effort with FIU's Extreme Event Institute. We are happy to partner with them in the 7th webinar dealing with the impact of COVID on South Florida. The start of the hurricane season in the middle of a pandemic is a double policy whammy of high consequence for many stakeholders. We hope this webinar sheds light on a complex dilemma. Making sense of critical issues was one of the reasons our center was founded in 1997 as an applied social research branch of FIU dedicated to inform public policy in the region. Since then, we have grown to become South Florida's leading urban think tank. Decision makers in the public, private, and nonprofit sectors turn to us for thought leadership and policy guidance to improve their organizations and communities. We are evidence-driven and dedicated to enhancing the quality of life in our region. We take pride in our contribution to FIU's national recognition as an engaged university. Before turning over the virtual mic to Dr. Richard Olson, Director of the Extreme Events Institute, I'd like to thank Ms. Helen Roldan, our Research and Outreach Coordinator, for arranging this webinar. Dr. Olson, you're on the clock.
Rich, I think you're muted.
Unmute.
There you go.
Okay, thank you very much. And it's a pleasure to add my welcome to Howard's. This is an unprecedented, or at least an uncharted area that we're in. And from the Extreme Events Institute perspective, let me just say that we have, but our staff, we have experience in more than 50 disasters, emergencies, and frankly, a few catastrophes. But I've never seen anything quite like this. Analytically, we are in a slow onset, slow exit disaster, a global pandemic with national to local impacts. And now, entering hurricane season for South Florida, we have the potential of a shock event inside a slow onset, slow exit disaster. So, to say that we're going to need our collective A game to get through this is an understatement. We really need our collective A game. There are implications for sheltering, for resources, for having people deploy, for volunteers, for travel. I worry in particular about families that are now in the unemployed. Main support isn't there anymore. I mean, we used to talk about people going from paycheck to paycheck, and now it's like day to day. And so my worry is for them in particular, how do you accumulate the stores and supplies you need for potentially a week or two? And as we all saw with Irma, who's going to evacuate and where will they feel comfortable going? It's hard to predict public behavior in a situation with so many tension points. And now we have to add civil unrest, which may continue for a while. So I'm turning this over to the panel, and I thank you all for joining us. Over.
Eric, if you have the reins.
All right, very good. Thank you, Dr. Olson. So good morning, everyone. I'm Eric Salna, Associate Director with the Extreme Events Institute, related to education and outreach. And I'm going to go ahead and introduce the panelists. And I'm then going to ask one question per panelist in conjunction with your presentation. So first of all, who we have on the panel today, we have Dr. Pablo Santos, a meteorologist in charge with the National Weather Service Miami office. We have Mr. Frank Rollason, the director of Miami-Dade Office of Emergency Management. We have Tracy Jackson, the director of Broward County Regional Emergency Services and Communication. And we have Paula Prendergast, with the executive director with the American Red Cross Broward County. And we have Dr. Keren Bolter, program manager with the Florida Hurricane Response Hub. So a great lineup of experts on our panel. And we'll start it off with Dr. Pablo Santos with the National Weather Service Miami office with a presentation and related to what are the general predictions and expectations for this year's hurricane season. Dr. Pablo Santos, it's all yours.
All right, so I'm gonna share my screen here. Okay, can you see and can you hear me?
Yes.
All right. Okay, so I'm going to run briefly, quickly, a few minutes with this presentation. So let's begin with the outlook for this season. You all saw the release from NOAA a couple of weeks ago, which is essentially calling for an above normal season, 13 to 19 named storms, 6 to 10 hurricanes, 3 to 6 of those major. They place the odds or the chances of us ending up with an above normal season at about 60% chance, with about 30% chance that it will be near normal and only a 10% chance of having a below normal season. So as it is, we are up to a good start. I think this is the first time recorded in the records that we actually have 3 named storms by June 3rd, so June 2nd, that is. So as it is, we are certainly up to a good start for that trend. Now, what are the reasons behind these forecasts? What is going on behind these forecasts leading up to an expectation or a forecast of an above normal season, or different ingredients? When we look at the Atlantic main development region, which is what that yellow box there is showing, we're looking at above normal sea surface temperature. This is part of what we call the one phase of the Atlantic multi-decadal oscillation that continues, that persists, started back in about the mid-90s. We're also expecting a stronger and wetter than normal West African monsoon season. This is the region where these disturbances, tropical waves, come off of, and as they track through the tropical Atlantic, they end up spinning into tropical cyclones. So there's expectation also for that season in West Africa to be more active than usual. We're also expecting, in general, weaker easterly trade winds across the main development region in the South Atlantic. When that is the case, any disturbance or tropical wave coming off of the African coast finds it easier to basically develop a closed circulation, which is the initial steps, the initial phase of what ends up being a development into a full tropical cyclone. And then, of course, we are anticipating a near or weaker than average vertical wind shear. Vertical wind shear, that's a technical term, but basically what it means is, think of it this way: as we go up into the atmosphere, winds increase in speed, of course, as well as changing direction. The stronger that change is, as you go up from the low levels of the atmosphere to the higher levels of the atmosphere, the stronger the vertical wind shear, as we call it. Of course, vertical wind shear inhibits or limits the ability of the storm, you want to think of it that way, to ventilate, okay? And that, of course, affects their development. Because we are expecting, or the expectation is that we're going to be either in a neutral La Nina phase, or maybe even transition into a weak La Nina phase as the summer rolls on and we approach the fall. One of the effects across the Atlantic Basin of such a phase of El Niño, meaning a La Nina, although a weak one, is that in general, the vertical wind shear tends to be weaker across the Atlantic Basin. And that is another factor in favor of, combined with the others, of generally more active than normal Atlantic season. Now, all of that said, I'm only going to spend 2 slides on that. The point that I want to make, that I want to bring home, everybody made such a big deal about the seasonal forecast, but I don't want you to, okay? This graphic showing at the top a couple of different seasons that we pick randomly that happens to be, well, not quite randomly, but purposely. At the top, it shows two different seasons that were above normal season, one on the left, upper left, 2011, with the section of Irene. Overall, we ended up with few landfalls on the U.S. Then you have 2005, where you have not only a very active season, but many landfalls. And then by the same token, you have seasons like the 2 bottom graphics here, where they were well below normal, and yet you have sometimes as many landfalls as some seasons that are more active than normal. And last but not least is 1992, Hurricane Andrew. Think about it for a second. We are up to 3 named storms in 2020. In 1992, the first named storm, the first one of the season, the 8th storm, was in late August, and that was Category 5 Hurricane Andrew. So we should not be making correlation between what the seasonal outlook is, okay, and the likelihood that you locally could get, could get impacted by a hurricane or not. All it takes is one. That's the main message here, and therefore we need to be preparing. Furthermore, we live in hurricane country, okay? As much as it pains me to accept we are in Cape country, because I am from, Florida State, is the truth of the matter is we live in a climatologically prone hurricane zone. We are to hurricanes like Norman, Oklahoma is to tornadoes, okay? And this is just a plot of all the hurricanes that have moved somewhere across South Florida, going back to the early part of the 20th century. This picture in itself makes the case. In these graphics here, I actually illustrate to you is a plot showing major hurricanes making landfall somewhere across South Florida, going back in the records. On the left is the early part of the 20th century. Look at all those major hurricanes that impacted southern Florida, including the 1935 hurricane, including many world-famous hurricanes, the Lake Okeechobee hurricane, all of them major hurricanes. Those are hurricane category 3 or higher. On the right, you see the major hurricanes that have impacted southern Florida over the last few decades. You can see there Charlie, you can see there Wilma, you can see there Andrew, you can see there, I believe, Hurricane Jean. Not shown there, I need to update that plot, is Hurricane Irma, just 3 years ago. So the bottom line, we live in hurricane country, okay? And recently we had some close calls, okay? We have not only Irma that impacted us in 2017, we had Hurricane Matthew that moved about 110 miles east of Miami as a category 4. We have Hurricane Dorian that moved just 140 miles or so, the center that is of Miami, closer to West Palm Beach. Think about it for a second, folks. That was a Category 5 that's parked is there for 24 to 36 hours, very close to us, okay? That could have been Miami, and I just want everybody to think, what could the impact have been here if we had had a storm of that magnitude parked over the Fort Lauderdale Miami corridor? You just try to imagine, and I think we can all agree that the consequences would have been horrific, right? I think we can all agree to that. So and add to that this season the complications associated with the pandemic that we're dealing with, or certainly is something to take very seriously. So the last few years have reminded us, despite our climatology, to put it in perspective, which is why I show you those slides, the last few years has reminded us of the exposure that we have, living right in the middle of Hurricane Alley. But it also has reminded us of the vulnerability of our community, okay? This is a graphic we put back after the 2010 census. This is something we will likely be updating when the new one comes out later this year or next. But basically it shows in the bar graphic how the population have grown in Miami-Dade from the early part of the 20th century up to 2010. And as you can see, we're looking at exponential growth in population. All of the active big hurricanes of the early part of the 20th century, these are what these lines here show, happened at a time where, relatively speaking, at least compared to today, the population was just a fraction of what it is today. So imagine this kind of activity superimposed over, across the area today, all right? Imagine again a potential Dorian impacting us directly. The impacts will be much greater. The risk is much greater just because of the fact that the population is much larger. And therefore, it makes the community in general more vulnerable. The risk is higher. So that's something certainly to bring home. And then you add up on top of that a pandemic, right? This is the same graphic but for Broward County. So basically, it just makes the point. One last thing I want to make on messaging challenges. Everybody focuses on the cone graphic, but the cone graphic only speaks to the most likely track of the storm. It tells you the region where there is a 2 in 3 chance that the center of the storm will track somewhere within that region, okay? But the impacts can go way beyond the cone. This graphic in itself shows that. As a matter of fact, this is from a forecast advisory for Hurricane Irma, shows the cone graphic superimposed. There is the wind field associated with Irma. You can see tropical storm force winds extending as far as the Carolina, South Carolina in this case, hundreds of miles away from the center of the storm. Furthermore, this is a graphic more or less indicating or showing the kind of storm surge inundation values that were observed right along the coast as Irma was tracking along the west coast of Florida. And as you can see, we have significant, even life-threatening storm surge values observed for hundreds of miles away from the center of the storm. You all remember as the storm was approaching the southwest Florida coast, we were seeing those pictures of rescues going on in downtown Jacksonville, just in the northeast tip of Florida. Again, highlighting the fact that you have impacts extending way beyond the center way beyond the cone and way beyond the center of the storm. So these are things that we have to address when we're dealing with a hurricane approaching our community, because it is a messaging challenge. We need to be asking ourselves relative to our community, what it is that we need to be planning and preparing for. With that in mind, the forecast office, we produce graphics that looks like this, that basically dissect in terms of the hurricane hazards, winds, storm surge, flooding, rain, tornado, what should we be planning and preparing for? These are not graphic of expected forecast condition, but rather for any given location or community, what is the recent worst case scenario that we need to be planning and preparing for as to not be taken by surprise, okay? We do this and we update them with every advisory once any portions of our local community of South Florida are placed under some sort of watch or warning, okay? But it's really good tool to help us plan and prepare for the storm. How can you access this information? Weather.gov Miami, you look to the bottom right of the page, you see a tropical big button that says tropical link. You go there and you will see all this information in there. The link in the slide there provides a link to a sample page that shows what this page would actually look like. So a few reminders here. South Florida is hurricane country and they need to always be prepared. Every storm and season needs to be taken seriously regardless what the seasonal outlook is portraying, okay? Please do not over-rely on the SAP forecast track. Otherwise, imagine what that would have meant to people living in Jacksonville, Florida, when Irma was approaching the Southwest Florida coast. Tune to your local National Weather Service office for detailed local threat and potential impact information. Ultimately, that is what should be driving your preparedness for any given storm. We are the ones responsible to take the Hurricane Center forecast and distill it down to what it means for your community. And one last bit of information I wanted to share with this panel was, remember there being four category 5 hurricanes that have impacted the mainland U.S. Beginning with the 1935 Labor Day hurricane, Camille in the 1960s, Hurricane Andrew in 1992, and then a couple of years ago, Hurricane Michael. 2 of those in South Florida. Well, 72 hours from landfall, they were tropical storms. They were not even hurricanes. And 5 days out, you go 5 days out, 2 of them did not even exist, had not even developed. So that should tell you something about how agile, okay, whatever preparedness plan you have in place needs to be. You basically need to go from 0 to 60 well within 3 days, okay? Sort of to apply the analogy of car racing. You need to have a plan that is very adaptable, is quick. It allows you to go up, get everything you need to do on time relatively quickly, because the most challenging storms, the ones that can be most threatening to your life and to the community as a whole, are storms that we do not have a lot of skill on forecasting. Those are related to rapid intensification. So that is the closing thought that I wanted to end with. And thank you for having me this morning.
Thank you, Pablo. Excellent. Really do appreciate that presentation. And I just want to help reiterate what Pablo mentioned. Yes, when it comes to a hurricane landfall in South Florida, when it comes to that specific information as far as the weather hazards affecting South Florida, the National Weather Service Miami office is your go-to source of that information. So make that a favorite website for all of you, because going to Pablo's website, you'll have all those specific graphics describing the effects. So very, very important. Thank you again, Pablo. All right, next up, we're going to go with Frank Rollason, the Director of Miami-Dade Office of Emergency Management. Frank, take it away. Frank, you're still muted.
The technology is just beyond us old guys. All right.
All right, we have you now.
I'm lucky that I was able to log on. So a good introduction by Pablo. He and I and the Hurricane Center work hand in glove, and we're even working on maybe co-locating here in the near future. At least that's our plan. We're in the process of moving to another EOC. We've just outgrown this one, and I think the latest with the pandemic has shown us that we need more space, and even with we're going to go to virtual EOC this time around and see how that goes. We're setting that up so we can keep the distancing. But the first question that I had here was about how we've been preparing for this season compounded by the COVID-19 pandemic. Just prior to the pandemic outbreak here in the United States, we moved from a warehouse that we had that had roughly 20,000 square feet to a warehouse with 67,000 square feet because we realized even where we were just planning for a hurricane that we did not have the space to completely stock the supplies we need to outfit the number of evacuation centers. So we had just moved into that new place and we're getting set in when the pandemic came. And fortunately, we did have that location in Medley. So we have stocked up on not only more hurricane related supplies, the dried food, the cots and the blankets, and all that equipment that we normally have to put out to the shelters. But also we've had to stock a tremendous amount of PPE, personal protection equipment. And we've been supplying not only the Miami-Dade Fire and Police, but the municipalities, fire departments and police departments with PPE. And then the hospitals, the nursing homes, and the ALFs, we've also been augmenting their supplies. So that is ongoing now. We still spend a great deal of our time pushing out supplies to the long-term care facilities. We've put out about 50 different locations every day with different PPE that they make requests for. But in Dade County, we have 81 shelters, which are schools. We have 20 primaries, and then we have secondaries and tertiaries, which give us a total of 81. And at any time, depending on the storm, the intensity of the storm and direction it's coming from, we plan on opening up to 75 of those, figuring that some of those will be in an area that we can't occupy. And we have the capability in our calculations of sheltering 112,000 people. That we base that on the rough population of Dade County. Well, I'm sure after the census we're going to be at 3 million in Dade. So about 2/3 of that live in evacuation zones. So that gives you 2 million sitting over there, and we take 5% of that is about what we figure on sheltering. But as the population grows, our ability to shelter people in an emergency situation has not been improving. Primarily, one of the impacts we have are the charter schools that are blooming everywhere, and they are not required by law to build to a Category 5 or provide Category 5 sheltering within their facilities. And so as the population grows and more children are being placed in the charter schools, that's has opened up classrooms in the school system for where they've expanded with the magnet schools, and they put in the computer labs in the classrooms and the different facilities that they use. But when it comes sheltering time, all those people come to the public schools. So that's an issue that we need to address, is how we move forward as the population grows. How do we keep pace with the space that we need to house the people in an emergency? And that's going to require legislative action. We're also, for instance, this big mall that's going to be built out at the West End, we're talking about putting a shelter in there with the people. There's trade-offs, gives and takes with needs that they need and things that we need. And that's one of the issues that's on the table, is to establish a shelter there that we can put a lot of people in that facility for the northwest part of the county. But what our plan is at the moment is that we will open up to a Category 3. We will open up double the amount of shelters or evacuation centers than we normally would. And that will allow us to double the space. Typically, we allow 20 square feet, 5 by 4 for each occupant, which is pretty tight. So we're looking to try to get that close to 40 square feet. But again, as soon as we do that, we reduce our capacity by half. But if it's a smaller storm and we open up more shelters, more evacuation centers, then we will we will be able to accommodate that with more distancing. Also, there's two other things that we are working on presently to incorporate into the evacuation centers with the school people. One is we've already installed in the EOC these ultraviolet light fans that kill the virus in circulation in the air. We're looking at putting those in the shelters in the congregate areas because not only is social distancing an issue with at least 6 feet, which is, you know, tough to get if we really got to pack people in, but it's the time, how long you are inside these areas that may have the virus. And so we need to try to clean that air as much as we can. The CDC recently has said that they're more concerned with the airborne virus than they are with the virus on the surface. So this thing is continually changing. So that's an issue that we can address with these fans. And the other thing we're looking to do is to actually put partitions in the shelters. And we're working with the vendor that set up the mobile hospitals here in Dade County, one on Miami Beach and one at the youth fairgrounds, where they did put these dividers in. So we're working with them. It's a tremendous logistical issue to be able to do that in a couple of days in the 20 of the primaries are the ones that we would look to hit. So we would put those dividers in and have those on standby, probably in tractor trailers that are either staged in a particular area or at the schools themselves to be able to try to again cut down on the distance and the exposure of the people. We will screen the residents when they come in. We'll take their temperature. We'll ask them if the typical questions of, are they feeling any symptoms, or have they been cohabitating, or if they themselves have been a COVID patient. And we will separate or segregate those people from the general population. If they've been with a family, we'll move the entire family together. We've worked out with the schools that besides having the larger congregate areas, we will have classrooms now, which we haven't had heretofore. So they do a deep cleaning in the summer, which is underway now. And they remove all the furniture. And then what they'll do is not put furniture back in half of the classrooms, and we'll have those classrooms that we can occupy also. And the other thing we'll do is we'll stagger the feeding so that everybody's not in line. Either we'll bring the food to them in the little cubicle areas, or we will stage it in a way so that probably about the time you finish eating breakfast, it'll be time to get back in line again for lunch. But that's sort of it in a nutshell as we're facing this pandemic combined with a hurricane. So that'll sum me up on my first go around. I'm done. We're wasting time.
Thanks so much, Frank. Tracy, you can go ahead and get started.
Okay, thank you. How am I doing with the technology?
So far, so good.
Okay, great. Hi, everybody. I'm Tracy. I serve as the emergency manager for Broward County. And many of the things that we're facing and undergoing are very similar to what Frank's pointed out. I think that one of the other things that I would add to what he said was that it really starts with planning and messaging on the part of our community. Everyone who's in an evacuation zone today should know they're in an evacuation zone. They should know what zone they're in, and they should have a plan to go somewhere. And we were stressing Broward that that plan be to go to a friend or a family member, keeping in mind that wherever you go, you do want to practice social distancing if that's not a household or a place that you've been in before. And that's just the reality of the situation we find ourselves in. The shelters are a shelter of last resort. So Broward will definitely open shelters as the need is there, depending upon the size, the speed, and the strength of the storm. All of our shelters from last year are all online now, and very similar to Miami-Dade County. We're prepared to open as many as we need to based on those conditions. There will definitely be a reduced footprint due to the separation and the COVID precautions. And so we really want to emphasize that people seek safe places where they can be. And if you know your home and you're not in a flood zone, then you may decide that being in your home, which was built, say, after Andrew or after 2000 is probably better. You may feel safer there for a Category 1 type storm, depending again on some of the other factors that Pablo mentioned. We know that water is the problem for most deaths following hurricanes, but every individual needs to know where they are today and know where they would go if a storm approached that would exceed the capacity of them to feel safe in their homes. As far as the shelters, the same thing that Miami-Dade is doing. We want to try to screen people as they're coming in. We want to try to separate, obviously, ill people from the rest of the people. And we want to try to do everything within the shelter while they're open to prevent the spread of disease. All of those things require help from the people who are shelterees. They still would be responsible to bring and wear their PPE, even though we'll have more for people who may not have it. They'll still be responsible to maintain distancing. They'll be responsible to keep their hands clean and wash them. So it'll definitely be a community effort as far as keeping everyone safe as we possibly can. I know that there will probably be lots of people who are fearful of going into a congregate, that's what we call them, a large shelter where lots of people are. And while that's understandable, if you're living in a flood zone, the chances are very high in a storm event with storm surge for potential loss of life. And if we announce a mandatory evacuation, we strongly recommend that the people evacuate. And for this reason, we definitely want to keep underscoring people knowing where they are and where they could go if they had a problem. We've also been using a word to try to get everybody thinking about the hurricanes as a protracted event. It has a beginning, it has a middle, it has an end. We call it preparedness, response, recovery. But your hurricane response for the average citizen really starts maybe in the 5-day cone and extends into the future. If we're hit, it extends until your life returns to normal. Well, what does that mean? Do you have generator power at your house? Do you have FPL power at your house? Are you able to live there safely? Then that event's not over for you until that happens. However, once a storm is passed and the roads are clear, generally in South Florida, we need to return the shelters to the owners, which is the school system. So there's definitely some gap time in there that we want everyone to make sure that they have themselves as prepared as they possibly can be. It's our resiliency as a community that really helps us get through the storms. Those of us in government, we do our best to help to prepare to take care of people that may have a more difficult time than others. And we recognize that these times, so many people have been impacted, loss of work and these types of things. So, but it's our resiliency as a community that really puts us over the top. We define resiliency as a strength and speed of a response to adversity. The strength and the speed of response to adversity. And we feel very fortunate here in South Florida because we know that our community knows how to prepare and to respond to these emergencies. So I think that's all I need to say now about where we are in terms of our preparations. Broward is ready to step in should the need arise, and we're happy to be in this community, and we're appreciative to be on this call. Thank you.
Thank you, Tracy. Thank you very much. Next up, Paula Prendergast, Executive Director with the American Red Cross in Broward County. And Paula, the lead-off question as far as when it comes to your sheltering plans and the American Red Cross with COVID-19, if you could address that as well.
So sure, I'll start off with that question. We are prepared to do health screenings for everyone entering. We've talked about the isolation care areas. A lot of the Tracy and Frank had mentioned, staggering meals. But our role primarily is to support the county's efforts. And we have offered the same support we did last year, but with the pandemic and COVID in mind, it is the safety of our clients and our workforce that are of the utmost concern. So we're going to follow all CDC guidelines and work with our health officials to ensure that we're giving the best possible care during, hopefully we don't get a storm, but during a storm should one arise. So I'd like to share my screen. I don't know, can you see it? Are you able to see it?
I can see it.
So first, I really want to start off with the Red Cross mission. I'm very proud to work for this organization, and the American Red Cross prevents and alleviates human suffering in the face of emergencies by mobilizing the power of our volunteers and generosity of our donors. And we have some incredible volunteers. Let me get to the next one. I think are you able to move to the next one for me, because my picture is in the way. Well, here, I'll just go. So if she can move to the next slide, that would be great. And I'm going to give it back to her. Okay. So what we do sheltering, feeding, and we care for disaster survivors. We educate the community on preparedness, and we teach life-saving skills. We also help the military and their families, and we provide humanitarian aid to all in need. And we do this 24 hours a day, 7 days a week, 365 days a year. So what we've decided, as a region, we've been, aggressive at delivering preparedness messages in the COVID-19 environment to the citizens of Broward and Miami-Dade counties leading up to hurricane season. And we've also actively engaged with the counties in the past to assist training the shelter workers as needed. So this partnership, it began prior to hurricane season 3 years ago, and the organization is currently developing a virtual training opportunity for our partners, and we'll make that available as soon as it's released. And as I mentioned earlier, we are poised to prepare to offer the same assistance as last year. We've committed to offering 8 shelter workers to 8 pre-storm shelters for Miami-Dade and 7 for Broward County. So what that means is, if needed, say we get a storm, depending on the scope and the scale of the storm, post-landfall, within 72 hours, we're going to work with our emergency management partners to transition all the families and individuals into long-term shelters that are operated by the American Red Cross. And as I mentioned earlier, these shelters will follow all CDC guidelines, and we're going to protect the safety of our clients and our workforce with that in mind. And I can tell you that our staff and volunteers have been attending enhanced virtual training workshops in preparation for hurricane season, with sheltering in a COVID-19 environment being a key priority. And one very important factor I'd like to mention is that since COVID, there has been no service delivery interruptions for our chapter, and also the Miami-Dade chapter in all of our region. As a matter of fact, we responded last week to the flooding in Miami. The week before, it was the wildfires across the Alligator Alley. And just last week, we had a home fire in Sunrise, which affected a family of 4, 2 adults and 2 children. So we have, like most, have adapted and adjusted to the current environment, and we have had no service delivery interruptions. And then lastly, I just want to emphasize, we've been prepared, we've been working really hard, and our teams are ready to respond and certainly meet the needs of the community should we be called upon. And that's all I have. Sorry, my screen wasn't coming up for me to click the slides, but thank you for sharing this.
Thank you, Paula. No, that was great. Thank you very much.
Yeah, sure.
All right, next up, Dr. Keren Bolter, the program manager with the Florida Hurricane Response Hub. I know you're going to tell us all about the Florida Hurricane Response Hub in your presentation here as you lead off. And Keren, you can go ahead and take it away.
Thank you. Can everyone hear me? You can hear me, Eric?
I can hear you.
Right, you can see the PowerPoint?
I can see that too.
Well, these speakers were amazing, all of you, and I'm just so thankful that I can be sharing with everyone today. And thank you for all the people who joined the webinar and took the time and that are making a difference and being active in what we're dealing with today. So I'm really excited to tell you about the Florida Hurricane Response Hub, and then I'll follow that with talking a little bit about some CDC guidance and some different challenges that we could anticipate. So I'll start with talking about the hub. We are the backbone organization of the hub is the Florida Institute for Health Innovation. And through our effort, we have professionals engaging in hurricane and disaster-related health recovery and getting them more access to quality trainings and technical assistance. And here, these are our partners. But first, I want to say that the reason that I'm here is actually through our affiliation with the Miami Climate Alliance. They have a disaster resilience working group, and there's some amazing leaders there. Joanne Paradin from the New Florida Majority, Myra and Zalalem from Catalyst Miami, and I think a big leader of creating this was Nazif Ganapathy from FIU. So I want to acknowledge them. And then here's our other partners that we applied for the grant with together. This is a CDC funded initiative that was originally supposed to be 18 months. So wrapping up soon. We kicked off at the beginning of last year of 2019. So, but because of COVID, we've actually gotten a 10-month extension. So we're using that to really make sure that we're sustainable in this effort and in working with all of our partners. So we have academic, governmental, grassroots organizations. We've worked with all of these partners to develop over 20 trainings, which we've delivered to over 1,500 professionals. We've fulfilled 15 technical assistance requests, and I'll show you our website where you can submit, anyone can submit a technical assistance request. And we've also developed a wide range of tools and resources. And so the Florida Hurricane Response Hub, the CDC funded this as a response to past hurricanes, and it was an opportunity where there were 5 other hubs around the country. There's one in Puerto Rico, Louisiana, Texas, and Georgia. So, we're all working together to have these technical assistance centers. Our approach is not to, duplicate efforts. We want to connect people and services and align with existing trainings and initiatives. So these partnerships are really important, and love to connect more with anyone interested. So, and this is our core team. So that's me on the right. And then we have Caitlin, she's on the webinar. I work with Caitlin really day to day to manage the hub. And we also coordinate with Kristen Garces and Roger King, they're all with the Florida Institute for Health Innovation. So this is our team. Our trainings are interdisciplinary. With the hub, we've put together focus areas, which are environmental hazards, mental health, climate resilience, equity, affordable housing, and emergency preparedness, particularly for assisted living facilities. So those are our main focus areas. And please go to our website, visit us on social media, you can learn more. But I'm gonna just jump right in and discuss how the hub has been adjusting efforts given the current threat of this unprecedented COVID-19 pandemic. So I have this little image of a triple threat, these cascading impacts that I want to talk about. In my main work, I assist local governments in preparing FEMA hazard mitigation plans. They're important for a lot of reasons, but they make local governments eligible for FEMA funding. So in these plans, you have different chapters, and one of them is hazard profiles. And you create profiles for a range of hazards: flood, wildfire, earthquakes. So we have this unique situation here that's not in any of these plans, where we're seeing 3 hazards unfold simultaneously, and they're intimately connected, and they're influencing the ways that people need to prepare and respond to them. So here we are, it's June 3rd. We just started hurricane season. We're still being cautious of social distancing. Now we have protesting, civil unrest. And so this is the triple threat: pandemic, hurricane, civil disturbance. And among all these hazards, there's particular individuals that are more at risk. And those disadvantaged communities are being hit the worst. all of the data is showing Black and Hispanic populations are the ones being exposed to the virus more. They're the ones losing jobs, and they're tired of all the injustices that have been piling up for them. And I was just hearing on the news this morning all these different ways that the pandemic is highlighting economic inequality for Black workers, how studies show that white people without a college degree are earning more than Black people that have earned one. Those students from Atlanta that were attacked by the police for no reason. It's so obvious, you know, and then we have a hurricane. It's mainly the low income minority communities that are going to be needing these hurricane shelters and the assistance. And then on top of all of that, there's always the additional threat of climate change. Climate change is a threat multiplier. It's going to exacerbate all of these issues. When Pablo was telling us about the hurricane science, you know, the key ingredient for a hurricane is heat. We have hotter atmosphere, hotter oceans. And again, with climate, we have climate gentrification. Equity is at the core. So with that was my little spiel on equity. I'm going to get into these important resources. I just wanted to mention, you know, for this slide, the cascading impacts among these disasters. And I just really want to echo what we're seeing and hearing everywhere and how things need to change. So here we are. These are a few hurricane considerations that we've been looking at, you know, with the overlap of COVID and hurricane hazards. What are the similarities? You know, we in the beginning, we were seeing people cleaning out the supermarkets, businesses shutting down, people hunkered down, you know, sheltering in place. But what about people who are in an evacuation zone or a mobile home and they can't shelter in place? So as Tracy mentioned, and Frank is always telling me this in terms of evacuating, that you don't have to leave your county. You can go, you know, as Tracy said also, go to a friend's house, go to, you know, in Broward County, the evacuation zones are pretty small. A is just east of the intercoastal, B is east of Federal Highway. So, you know, all you have to do is go a little bit west and you'll be out of the zone. So some of the things to consider before, during, and after the storm is how these individuals in these evacuation zones might be more reluctant to leave their homes. They've been told to stay at home. That's another thing that Frank says. Also, when people have been talking about this, what to do at the shelters, implementing health checks, creating isolation, and I'll talk a little bit more about that with the CDC guidelines. Frank talked about the social distancing and what they're planning for. The hotels are closed, were closed for the pandemic, a lot of them, but even if they are open and it is a possibility, how can recently unemployed individuals afford a hotel, even if FEMA is offering some kind of help for the hotel? We've heard in the past that they will still ask for a $200 deposit, which people don't have. So there's challenges there. Adjusting public transport for people that don't have a car and need to evacuate. What if, you know, there's less emergency response workforce because people are sick, or first responders that are at risk are staying home? What happens when there's damage and power outages and people that are sick or in quarantine, you know, they have no service and they're trying to get help? So these are some of the challenges. And then after the storm, what about sanitizing all of the donations that are received for the victims? What about when there's less availability of crew to clear the debris, to repair and rebuild? So these are some of the considerations we want to be thinking about. This is a long list of different resources that I wanted to share, and they're all links here. So when you get the PDF, you can explore all of these links. So I'll just go through them really quickly. On the next slide, I'm going to talk more about the CDC guidance of how to shelter during a pandemic. Another really cool resource from the American Flood Coalition is the Dual Disaster Handbook, which helps community leaders coordinate a proactive response to flooding during COVID. And there's 6 main recommendations. The last one is to document disaster expenses. It's really important to document this stuff because afterwards, getting the, like I said, I work on, my main job is FEMA funding, and these applications, having documentation and expenses is one of the most important things. So the third item here we have is from the National Center, the third resource, National Center for Healthy Housing. This is an amazing resource for general safety from environmental hazards in the home, and urgency for safe and efficient cleanup. We know that moisture means mold. It has a big impact on indoor air quality. They're talking about, they had a webinar yesterday, and people still don't realize that if you put your generator, it's not ventilated, you have the generator on, there's carbon monoxide poisoning. So there's just all these different important things to make sure that you can stay safe. The other resource also from Enterprise, number 4, the Keep Safe Guide to Resilient Housing, talks more about passive habitability, the safety of what do you do when you don't have power, and other really important things to consider. The floridadisaster.org, the 5th item, is just an amazing plethora of statewide resources. They have a mapping portal with the evacuation routes and the real storm surge zones. I say real because I get really frustrated when a hurricane is approaching, and on the news we see these like huge swaths of the coastline, and it's 10 to 15 feet of storm surge predicted, and people completely freak out, and they leave, or it's just, they don't understand what their risk is. And if you actually go to one of these portals and you can actually see the outline, and a lot of places are in Miami-Dade and Broward are just not even in a storm surge zone, even the worst possible category 5 with 6 feet of sea level rise. Most of Broward, especially Northwest Broward, is completely out of a storm surge zone. So it's really important to understand what your risk is and explore those tools. You can also customize an emergency plan. It's really easy to put your information in, and it just automatically generates a PDF with your specific information. The 6th resource is the Miami-Dade County official rules for activating the evacuation centers. So Frank talked a lot about that. They have, it's really easy to look at infographics, very simple about what the rules are for screening, distancing, wearing a mask, sanitizing. So really great website for Miami-Dade County. The Broward County website is also really great. Like Tracy mentioned, there's a repository. It's easy to search where the shelters are. The 8th resource is from the National Institute for Environmental Health Sciences. That's the picture here. They have training resources on safety awareness for responders, how to protect yourself while helping others, while removing debris. This is another thing that Tracy said, the surge, and also Pablo, there's this wind versus water contrast, and that if there's a storm that's mostly wind, most of the injuries are actually happening during preparing for the storm or the cleanup. But when the storm surge is coming and it's the impact of the water, that's where you get loss of life. The last resource I have was actually just released from FEMA. It's called the COVID-19 Pandemic Operational Guidance for the 2020 hurricane season. It is a 60-page document that goes through all of the anticipated challenges, response planning, and recovery planning. So all of these are links that you can look through. So I'll just go through a little bit of highlights from the CDC guidance. It's a 9-page document, pretty short. It has a lot of recommendations and specific guidance on what to do. They really recommend smaller shelters, fewer than 50 residents, to be prioritized, and that larger shelters should be a last resort, and that as soon as as soon as people can leave, that you demobilize and quarantine somewhere else. They have guidance on how the shelter health staff should be monitoring residents, not just for COVID, but also for mental health and general wellness concerns. And they have resources on daily life and coping. There's guidance on the intake and screening, monitoring temperatures daily. Of course, the people with symptoms will be isolated in a separate area. Frank was talking about having a lot more supplies, PPE. They specify that the masks should be cloth and have as many tests and test as much as you can if possible. There's also instructions on how often to sanitize, considerations for air filtration. I was excited to hear Frank talk about those UV fans. Those sound really important. They have recommendations on how to care for children, managing their naps, their toys. I mean, it's very specific for a 9-page document. What to keep away from children, sanitizer, children under 2 should not wear masks. Everyone, all the shelters have to allow service animals, but they do not have to wear a mask, of course, but handlers should be given gloves and dispose of those frequently. So those are the main guidances from the CDC. I wanted to end just by adding a few more anticipated challenges. And in that FEMA guidance document, there's a lot of specifics about challenges with the availability of resources. If you have less space, less staff, less PPE, this is one reason that larger shelters might be required, because a larger amount of smaller shelters mean that you need a lot more staff to be able to disperse among those shelters. We should anticipate the added complexities of conducting response and recovery operations while taking preventative measures to protect the health and safety of disaster survivors and the disaster workforce. They talk about coordination through virtual communication. A lot of these trainings need to be done online to get more volunteers, and the Red Cross is doing that. FEMA is also organizing national incident management assistant teams that are on standby to support any disaster operation, and they're modifying equipment to ensure self-sufficiency. On that note, I just wanted to end on a more kind of general reflection of what I'm hearing. Anticipated challenges that are related to the uncertainty and instability that everyone is experiencing right now. People are experiencing issues with being isolated, feeling vulnerable, their safety, their health. There's also the divisiveness that's occurring in our country, a lot of anger triggering, and that's really what scares me. I wanted to share, my mother is a life coach, and her commitment is for people to be happy no matter the circumstances. And she created, through what's going on now, a weekly support group. It's just a Zoom chat to connect and inspire people. And just from sharing what we're dealing with and sharing how we cope, we get out of our heads. And this is just such a healthy way to really make sure that we're experiencing wellness in all of this craziness and getting out of your head. I mean, there's so much value in articulating your thoughts in an open space and being moved by other people sharing and relating to what they're dealing with. So, we had the group last night and we were just hearing nightmares of what people were dealing with, and they were so thankful. So I really recommend, in addition to all these resources, I can also add the link for my mom's group, but there's so many groups where people are, it's not professional, it's very just open and accepting, and really I feel like things need to move there as well. We need to be integrating wellness into everything. So thank you so much.
Thank you, Karen. Thank you so much for that. Great information there. So at this point, we are now going to be certainly asking more questions. I know a lot of the viewers of this webinar have been submitting questions. But before we get into that, I would like to ask just one follow-up question at this point for Frank and Tracy. And it's a question we were interested in. And the question is, what are your plans for assisting vulnerable and special needs residents who need emergency and evacuation assistance? Frank, I'll let you go first, and then Tracy, you can address the same question too. Frank? Frank, you're still muted. There we go.
Okay, yeah, you have to unmute me. You got me gagged. All right, so let me hit on the vulnerable residents real quick. In Miami-Dade County, we have a list of those individuals that sign up ahead of time, and right now we have about 3,500 that are on the list. We do a call down several times during the year to make sure that the people are still there, that they don't want to get off the list, they've made other arrangements. And so that happens about quarterly, that we make the call downs. We bring people in, a load of volunteers come in to do the call downs. During an actual activation, the people that are from the fire department, what we call DAEs, disaster assistant employees, and the staff from corrections are assigned that duty to make the actual call downs to these people to arrange to pick them up. What we find is about half of them take us up on it when it's a blue sky day, as we make the calls, and we make arrangements to go and get them and bring them to the proper facility, either to a hospital or to one of our medical evacuation centers, of which we have 4 of those. And we're opening up a 5th one that we're working with Florida Power and Light on right now to get emergency power into that one, so we can have more social distancing and spread the people out. And then what happens is the weather starts to turn bad, the people that decided not to be picked up start calling in to say they want to get picked up. And we do that as much as we can up to where it's not safe to move them, and they have to end up sheltering in place. And then we have the group of people, which just about equals the number that we have on the list, that then call in and say, I didn't sign up, but I need my mother or my father, or I need to be picked up and moved. So that's the plan that we have. The biggest challenge that we have this time around is the nursing staff, because with the COVID going on and the care now that has switched really from the hospitals to the nursing homes and the long-term care facilities, the need for the nurses has increased dramatically. And that's the same pool that we have to pull from to activate the medical evacuation centers. And so we are now looking to get into contracts with private providers to provide the nursing staff that we need. So that we've got a plan. It's certainly has a new element in it with the COVID, but we're addressing it.
Thanks, Frank. Real quick, is there a link, or if someone wanted to still sign up, where would they go?
Well, in Dade County, you can just call 311 and they will get you right into the system to sign up. That's the easiest. You dial 311 in the county, say you want to get on the evacuation list for special needs, and they'll hook you right to it.
All right, great. Thanks, Frank. Tracy, anything, what do you have to kind of add what Frank mentioned? Not sure if Frank or if Tracy is muted, and I'm not sure if.
Yeah. Yes.
There you are. Okay, there you go.
Did you guys think I was Frank? You had me on mute over there.
Yeah.
Oh, no,
ahead,
I'm
Tracy.
kidding. It's essentially a carbon copy. We have a vulnerable population registry, special needs registry, best access through 311, and there are periodic what we call call downs for those people. I think that one thing that we are doing that's a little bit different is through our medical director, they are trying to get some assistance through their contacts at the state for what we also call higher level of care people. And the whole idea is to spread out the patient load, because there are going to be fewer people available to take care of people. And so they're approaching it from that angle. But all the preparations that we made for our regular shelters, concurrent preparations have been made for anybody involved in our special needs shelters. Obviously, those people are power dependent. And so we actually secure a couple of generators for certain shelters. We lease them for the entire hurricane season, and we put them on site when we're going to put the power dependent, oxygen dependent people inside those shelters. And that contract runs through the end of hurricane season. And so should there be a need, we will want to make sure that those people, once we bring them in, are going to be with that life-saving electricity at all times.
Great, Tracy. Thank you. Real quick, also the sign-up process for Broward County.
Easiest way is 311. There's also a link on the website, but pretty much everyone has a phone. And so 311 in Broward County will get you a hold of our Broward call center, and they will get everything connected for you.
All right, excellent. All right, at this time, we are certainly going to keep the questions coming. They've been coming in from all the viewers here to this webinar. At this point, Helen, you're going to kind of help facilitate this part of the discussion. You've been observing and monitoring the questions. We've seen a lot of them come in. So Helen, would you like to kick this process off on the additional questions?
Yes, we only have about 15 more minutes left, so we're going to try to get to as many as possible. This question, I'm not sure if Paula is still there. If you are, what would the policies for people with COVID-19 who show up at the shelters or test positive while at shelters be?
So as I mentioned earlier, we're going to have very specific screening processes, and there will be isolation care areas in the shelter. And we're going to work with our public health officials and certainly emergency management and follow CDC guidelines, because again, it depends on, the time, location, perception of the risk. But we have these isolation centers in mind, and that's one of the routes that we're going to take.
Thank you. This next question is for Keren. What does FEMA assistance look like? How long will it take local governments to get the resources they need, for instance? Do you see that some communities may get the resources quicker than others? You can shed light on that.
I mean, in terms of the resources, I mean, most of the funding I do is with local governments, I haven't helped individuals, but I can, when I send the list of resources, I'll send lists of what individuals can do. And it's not just FEMA that is helping. There's also Rebuild Florida, and HUD has the CDBG funding and all kinds of funding. So there's a lot of different resources for individuals to get help. But in terms of the timing and how long it will take, I hate to say that FEMA is not great about that, and sometimes it does take a lot more time, unfortunately. So I'm not extremely optimistic there. I'm sad to say that, but it's really, there are a lot of opportunities to get help, and I don't have information on the timeline, but like I said, it wouldn't have high expectations. I wish I had more to say. Thank you.
Thank you. This question is for Frank. Will CERT training be available online? And what is the plan for managing restrooms and potential COVID-19 cases in shelters?
Okay. On the CERT, we do the CERT training regularly. We're doing it virtually, and we're also doing it in groups. And you can contact us at on our website for emergency management, and Miami-Dade emergency management. We can hook you into that. That's not an issue. And what was the other question that you asked?
Is there a plan for managing bathrooms and potential COVID-19 cases in shelters?
The cleaning of the bathrooms?
Yes.
Yes, the school, when we're in the schools, the janitorial service is provided by the school staff, and there will be a stepped up process in the cleaning and sanitizing of those areas.
This is a follow-up question for you. Did you mention that PPE, cots, and more would be available at shelters this year?
Yes, we will supply PPE. We recommend people bring their own masks and gloves or sanitizers, whatever they want, but we will have that. We'll provide cloth masks, and we will provide hand sanitizer, wipes, that type of thing, gloves. We also have a smaller masks for children. So we're, stocking the stuff up as best we can get our hands on it. It's tough to come by. As we're getting past the initial part of the COVID deal where masks were the hard thing, now the hard thing to get are wipes, hand sanitizer, any of the cleaning products are now they're the difficult items to get hold of. It's easier to get masks now, but not as easy to get the cleaning supplies.
Thank you. This next question is for Tracy. Do you have any tips on large continuing care retirement communities preparing for a hurricane?
There we go. Is that better?
Yeah, we can hear you.
Okay, great. Could you repeat that? I didn't quite get that, please.
Yes. Do you have any tips for large continuing care retirement communities as they prepare for a hurricane?
Well, yeah, my only tips really are that, again, the existing plans and the things that everyone does typically for a hurricane aren't things that should be lightly looked at. As a matter of fact, it probably will take longer this season to procure the regular supplies and medicines because of the hours of operation of stores, social distancing. Things are a bit slower. So my tip is to start today to do, if you haven't done your typical preparations, you definitely need to do those right away. And for those communities, obviously, I would underline what Frank was saying about the personal protective equipment and making sure that they keep themselves as safe and as clean as possible, because that situation is what we all really want to make sure we keep foremost in mind as we're going about the business of responding to a threat.
Thank you. This question is going to be open to the panel. We've gotten a few questions about pets. Frank had just asked, will the pandemic affect whether there is space for pets in shelters? I have a pet sitting company in Miami and many are concerned, especially about implications from COVID.
Well, this is Frank. Our pet-friendly shelters will be open. We have 8 of them. There are some different rules that are going to be put into place with the people moving back and forth from the pets and especially the cats. The cats seem to be an issue. Wear gloves when you're handling them, and sometimes the cats, you don't handle gloves. You don't have gloves on all the time, and now the pets start getting skittish when you start coming at them with the gloves. But we need to keep in mind that we would need to protect that general population as much as possible from spreading the COVID. But the pet shelters will be open in Miami-Dade County. Pet-friendly shelters, where you go with the family with the pets.
Thank you.
Right.
Tracy, did you want to add something?
No, so same thing, but again, the space considerations pretty much are going to, we feel, impact the pet-friendly shelters in Broward as well. Obviously, a person and a pet is kind of like a duo, right? So if I have less space for people, it would make sense that I might have less space for pets.
Got it. And then this next question is about the special needs community. How can those with special needs be prepared for hurricanes, sheltering? Is there space for individuals with special needs, special consideration?
Yes, in Dade County, we have special needs shelters, medical evacuation centers, we call them. There's more space generally allotted for them. Usually it's close to 60 square feet. They should come with a caregiver. Sometimes we find these people get literally dropped off at our doorstep. They don't have anybody with them. They get dropped off. They have no one to care for them. We do have nurses there, but sometimes these people need one-on-one care during the period of time. And we also shelter at the medical evacuation centers those family members that need to be there to care for those people. So they need to come with a caregiver. If they currently have a caregiver at home, they're still going to need a caregiver when they come to a shelter. So that's a thing for them to keep in mind. But the shelters will be open and we are expanding them so that we can give more space.
Thank you. Do any other panelists want to chime in on this one? Okay, our next question. Will there be investment in an enhanced real-time communication system accessible to all Miami-Dade County residents or Broward residents, such as text communications? The person who asked the question is concerned that sometimes notifications get sent too late, and people aren't getting their information quick enough.
Well, Listen, that's a good point. Social media is used more, and we do use that with our PIOs, our public information officers, that update the pages. But I would recommend that in Miami-Dade County, you can download the app Ready MDC. If you go on, you can get that on Google, or you can get it, at the App Store. That has a series of areas that you can click on for information on dealing with the shelters. It tells you which shelters are open and what the capacity is. And when we close down a shelter, that shelter will go off the screen. You'll also have the bus pickups if you need bus transportation. It has a window there that you can go on. From your phone, it'll give you the locations of the bus places close to you. It will tell you when the bus pickup is going to be, how far away it is. That's there. There's also a window you can click on that deals with any of the emergency orders, evacuation orders that have been issued by the mayor. So that's a real neat app to have. And the other thing that you can certainly go on and get on is the sign up for Miami-Dade alerts. And that's you go on the Miami-Dade website, miamidade.gov, type in alerts. It will get you that, and then those alerts will come to you as the mayor puts them out, or we put out a special alert. Rather than you having to go to the app, it'll come on your phone. You'll get an alert right away of an evacuation zone or something of an emergency nature that we have to let you know right away. So we are using social media more. It's a back and forth type thing, but I think having this app and having the Miami-Dade alerts will certainly alert you while you're busy doing things or getting ready for the storm boarding up. It'll keep you up to date with what's happening at the EOC.
Thank you. And a follow-up on that from Kate. For people who aren't tech savvy or don't have regular access to the computer or the internet, what other methods are being used to communicate with them?
Certainly the radio and the television. The information that we put out, there's usually a crawl on the bottom of what's being done by the different weather outfits that are happening. And so it'll tell you about shelters, it'll tell you about, and that's usually by county. Tracy will have stuff going up there in Broward that are pertain to Broward. Miami-Dade will have stuff for us. Monroe will have stuff for them. So, somebody eyeballing the TV or having the radio tuned to one of the channels that's covering it, they get the same information that we put out, we provide to all the media for them to get out too.
Thank you. And then another follow-up question. Are these messages typically in different languages? English, Spanish, Haitian Creole?
In Dade County, they are. We
Tracy?
have them interpreted.
Do you know if in Broward they are?
Yeah, the Office of Public Communications has a number of channels and outputs that they push the messages out to, very similar in Miami-Dade County. So when they're putting information out there, they're trying to get as many members of the community informed as they possibly can.
Great, good to hear. We have time for just a couple more questions. This next one is for Mr. Jackson. During your presentation, did you suggest that a home in a non-flood zone area built in the 1990s is not safe for Category 2 or higher?
So that statement was based partially on some guidance that I believe we're getting from the state. But let me rephrase that. The South Florida Building Code is one of the most stringent building codes we think in the country, has been for a long time. However, a home is only as good as the person that built it, and the code's in effect at that time. There's losses that the insurance industry has based on hurricanes that come through, so forth and so on. And at the state level, they're examining that information in an attempt to help people understand the risk factors of staying in the home that they're in. So, Tracy, the emergency manager for Broward County, says you should know your home. You should speak with your insurance agent. You should know everything you can about the construction of your home, and you should use that information to make a decision as to how much risk you're comfortable in taking in the approach of a storm that is a wind event. If we have a storm that is projected to produce significant flooding, whether it's from water coming down from the sky, water standing underground or being pushed on shore, and you're in an evacuation zone, you need to leave.
You know, I think another point that needs to be driven home is that the South Florida Building Code went away after Hurricane Andrew. There was a building commission that was put together, and there was a statewide building code that was put together when we saw the destruction that took place. And like Tracy says, a lot depends on your builder and on the inspections taking place to make sure that the hurricane clips and those type of things are done. But keep in mind, the wind load that we talk about in the building codes is just that. It is the wind load on your impact windows, the wind load on your roofs. That's all wind load. Completely different from a storm surge or tons of water coming crashing down. An impact window is not designed to keep a storm surge from pushing that window right out from the wall. It's not designed for that. So when people say, well, you know, I've got a new roof and I've got impact windows and doors and I'm set. Well, you're better than not having those when it's a wind event. But if you're in an evacuation zone and we're expecting a storm surge of 12 to 15 feet, I mean, Andrew was 18 feet down in South Dade, and you get that coming up on a residence over the roof of a house, the doors are going to come in, the windows are going to come in, and you are not going to be safe in those conditions. And that's why we say hide from wind, run from water. You need to get out of those evacuation zones if we're expecting a storm surge coming out of any size. The buildings are not built for that.
Well said, Frank.
Thank you. And I'm going to ask one final question because it's getting time to wrap things up. This one comes from Rick. So Rick is specifically asking about the keys, but I do want to open it up to you know, Miami-Dade County and Broward and beyond. Are there any provisions for first responders in the keys when they're required to evacuate in order to feed them so they can be able to assess the keys for damage?
Oh, are we talking post-storm? When you say first responders, we're talking after the storm?
It seems like it's, yes, it seems like it's first post-storm.
I mean, that is set up. We have vendors, we have methods with our urban search and rescue teams. Part of that is a feeding process. I'm sure Tracy's got the same thing up there that we have. And the other thing that we have, which is kind of neat in Dade County that we'll be using for the first time, is we have a drone program, and we will be able to get into these areas that have been hardest hit very quickly to be able to assess the damage. And we have a program with tags that have gone out in the hurricane guide that you hang a tag, a red tag on your door if you need help, or a green tag if everything's okay after the storm. And these drones will fly through, and if they find that you have an issue and you've got a red tag hanging, that drone will drop a pin, send back a location, and we can get a team in, even if it has to be on foot, to try to get to that area to help those people that have those red tags on. But feeding is not a problem. We've got a system to keep everybody fed, the first responders.
Tracy, did you want to add anything to that?
No.
Okay, well, thank you, everyone. With that, this does conclude our session this morning. I do want to thank all the panelists, Dr. Pablo Santos, Frank Rollason, Tracy Jackson, Paula, Prendergast, and Keren for speaking with us this morning, and everyone in the audience for tuning in. I'm going to just remind everyone very quickly, we will be sending the recording and the presentations of this morning's session to all registrants. And if you have any questions, we'll be sending the contact information for our panelists as well. So thank you so much for joining the conversation, and we hope to see you next time.
Bye-bye.
Thank you.
Thank you.
Bye.